We have a few minutes left, and I'd like to discuss what you, the panelists, think of the unmet needs here. We have some really revolutionary agents that have come about over the past year in terms of FDA approval. As you think about their shortcomings, what do you anticipate in terms of second-generation agents or other modalities that we can look forward to? Michael?
Well, I think one frustration I've had is that right now these drugs are approved for hATTR peripheral neuropathy, but they're not necessarily approved for cardiomyopathy or even wild-type disease. But certainly hereditary TTR disease, I view as one disease. I don't view it as neuropathy or cardiomyopathy. And I think maybe we can even take a step back, and all TTR disease is similar. And so that's a struggle I have in speaking with patients who may have hATTR cardiomyopathy, but may have no neuropathy, but can't then get these therapies.
That's a very important point. And Akshay, if you could give us your perspective on the secondary data that's been generated from both the patisiran and inotersen studies, and your perspective on the capacities of these revolutionary agents to impact, to treat and impact ATTR amyloid cardiomyopathy.
Right. No, I think the point is critically important, which is that in some ways the burden of TTR disease far exceeds the burden of hereditary amyloid polyneuropathy, particularly as it relates to the heart. And so I think the ability to expand these therapies to the broader population with TTR amyloid, I think is an important next step. When we think about the data that is available, we have data from Apollo, from a pre-specified subgroup of patients with cardiomyopathy defined as having wall thickness more than 13 millimeters. That population of patients, which was, as you mentioned, about 60% of the total population in the study, was followed for the full duration of the 18-month follow-up and had echocardiographic surveillance over time, as well as biomarker assessments. And what we know is that the patisiran-treated patients compared to the placebo-treated patients had less progression in ventricular hypertrophy, improvements in longitudinal strain, that is a marker of cardiac systolic function, improvements in cardiac biomarkers, particularly natriuretic peptides, and in post-hoc analyses that were not pre-specified, also numerical reductions in the rates of hard clinical outcomes, including heart failure hospitalizations and death. So I think the impressive thing is that there does appear, in parallel with the reduction in progression of neuropathy, to be some decline in the progression of important markers of cardiac disease progression, and certainly of incident heart failure, which is a lot less in the trial. For the inotersen trial, we have shorter follow-up at 15 months, less robust data from echocardiographic parameters, but again, the same signals with reduction in wall thickness, not a signal with regard to longitudinal strain. I think comparison across trials is a little difficult since as was mentioned, I think the trial inclusion criteria are a little different. The severity of disease may have been a bit different between the trials, but still about 60% of patients in the inotersen trial also had clinically apparent cardiac involvement. So I think there are some really positive signals of stalling of cardiomyopathy progression and reduction in incident heart failure, and potentially significant impact on hard clinical outcomes that are really enticing. And I think we need more data.
Jim?
So one of the concerns I have, and I don't know how we get around this, is just the cost. I mean, these drugs are $450,000 a year per patient. And I think we all think that, we talk about 50,000 patients in the world, but it probably is much greater than that. And how are we going to pay for that? How do we get this drug out to the third world countries, these drugs out to the third world countries? And I don't have an easy answer for that, but it seems that these drugs really are going to change the future for people with hATTR, and we have some sort of responsibility as a society to try to treat people.